Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our Tri-County Weekly Update for Peoria, Tazewell, and Woodford counties. For today, March 18th, the Tri-County now sits at 35,335 cases to date. That's 35,335 cases to date, which is an increase of 509 cases over the past week. That brings Peoria with an additional 282 cases over the week to 17,534. With an additional 177 cases, Tazewell now sits at 13,945. And with an additional 50 cases, Woodford County is now at 3,856. We are saddened to report 3 additional deaths over the week, which brings our totals to 592. That includes Woodford County reporting 2 deaths to date. Both actually occurred in December, and similar to what had happened with us during a case review, they were identified. It was a woman in her 80s and a man in his 90s, both associated with a long-term care facility. With that brings Peoria to 286 deaths. Tazewell remains at 237, and Woodford is now at 69. Overall, 97% of our population is considered recovered, 2% at home and isolating, and 0.06% hospitalized. We did see an increase over this week in terms of cases per day for the Tri-County region. Last week, we were averaging 50 new cases each day for the Tri-County, and now we're at 73. Likewise, we saw a slight increase in the number of ICU beds in use from an average of 6 ICU beds in use to 8, while the med-surg stayed at 20. Right now, our hospitals, which is OSF St. Francis Medical Center, UniPoint Health, Proctor, Methodist, and Pekin, reporting 8 ICU beds in use and 24 non-ICU beds in use. I think what's really important to note is that there's been a lot of energy, and we will also discuss what the governor announced today as well, but a lot of energy around we're seeing more vaccines available in our community. There's a sense that we can see that light at the end of the tunnel, but again, it's not a time for complacency. We still need to make sure that we are masking properly, that we are taking advantage of all of our testing sites, as well as if you're ill, staying home, isolating, getting tested, and then practicing that good hygiene and social distancing. As the governor mentioned, and I'm going to reiterate, masks are still mask mandate is still in effect. We are not going to be changing that until the CDC changes those guidelines. So again, the Tri-County, we've had a lot of success, but the pandemic is not over, and we want to continue practicing those good steps. The other big news that was released today was regarding this move towards a bridge phase between phase 4 and phase 5. With that in mind, what does that mean? First of all, unlike other phases that the state moved to, this is not going to be done regionally. This is going to be as a state as a whole. So we are kind of marching together between phase 4 to the bridge to phase 5. So with that, what are the magic numbers? So for us to move from phase 4 to this bridge, we need to get 70% of those seniors 65 and older vaccinated with at least 1 dose. Again, that's 70%. Right now, the state sits around 58%, and so really wanting to push that here in the next few weeks. The other big announcement is that starting in April 12th, everyone 16 and older would be eligible to get vaccinated. Now, I do want to reiterate to individuals that are 16 and 17 that right now there's only one of the 3 vaccines that is available for you, and that is the Pfizer vaccine. So before you make an appointment, you may want to check to make sure that that location has Pfizer for you. Again, for 16 and 17-year-olds, the only vaccine that's available currently for you is the Pfizer. So please call ahead to make sure that is the vaccine at your site. We also want to reiterate that the state did start a call center to help with vaccination appointments, and that phone number is 833-621-1284. Again, that's 833-621-1284. And we still are utilizing 211 to help support individuals here locally as well. But again, take advantage of all the different options to get a vaccine appointment. There's lots of avenues to go through. And again, you're not going to hurt my feeling if you don't come to the health department site. You're not going to hurt anybody's feelings. All we want you to do is get vaccinated as soon as possible. And then the other update we have is regarding testing. So Heartland will still remain operationally Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. However, there are going to be new hours for the Civic Center site. It will now also be Monday, Wednesday, Friday, and Saturday from 8 to 4. Again, that's Monday, Wednesday, Friday, and Saturday, 8 to 4 for the Civic Center option. With that, I'll open it up to questions.
Yeah, Monica, one of the things that I've been seeing a lot on when you see the news, people are out there trying to vaccine shop, sort of. There are three. Some people get caught up in the numbers. One is more effective, one is less effective, one has 2 shots, one is 1 shot, one makes you very sick on the second shot, one does not. Are you worried that people are going to tie up certain sites and thus they're stuck on one, you know?
So I think that's a great point, Andy. There are 3 vaccines that are available, and all 3 of them are effective. If you have any option to get any one of them, get it. I know that there are differences that you read about, but again, where it matters in terms of mortality, which is death, and severity, they all match up. Now again, Johnson & Johnson is just a 1-dose vaccine, while the Pfizer and Moderna are going to be your 2-dose vaccines. So again, there's going to be a little bit more planning in terms of making sure you get that second dose. And I want to also touch point, when you look at the guidance that's going to be released regarding moving to phases and what it means for someone to be vaccinated, you need to have been 2 weeks out of either your second dose, if you got Moderna or Pfizer, or your single dose for the Johnson & Johnson. So that means individuals that may have only gotten 1 dose of Pfizer and Moderna, you are not considered fully vaccinated. You will be considered fully vaccinated 2 weeks after your second dose. So again, make sure you are getting to that second dose appointment and getting it done as well to be fully vaccinated.
So I know that 1B plus included a lot of people throughout the Tri-County, but are we ready, for the big influx to open the floodgates, so to speak, on April 12th to everybody?
So the question is, moving with that April timeline, having already been a little bit hesitant moving to the 1B+, how does the Tri-County feel? Right now, we feel pretty comfortable about moving towards it because what we understand is there's going to be an influx of vaccines, specifically the Johnson & Johnson, and that's going to be a game changer for us. So it's always been about allocations, and now that the state has seen those 3-week projections, they know what we're expecting to get. Our numbers are steadily increasing. We've had 2 good solid weeks of increases in our vaccine. The 3rd week we see a little dip, but that also is the week where we expect Johnson & Johnson, which we haven't gotten final numbers for. So as long as the volume of vaccines and allocations increases, I think we're going to be comfortable moving into that that kind of open eligibility on the 12th.
So how much vaccine are you expecting at that point compared to what you're getting right now, and when's Johnson & Johnson coming, and how much are you expecting?
So for the Tri-County, we've seen a slow increase. For example, I think this upcoming week, between the 3 counties, we are just over 8,000 doses. Now, again, we do a slight dip because of that second dose kind of upsurge that we need. We don't have our final numbers for Johnson & Johnson, but what we understand that's coming in is going to be large enough to fill that gap that we're going to see. So hopefully, we're still on par to go from 8,000 and continually grow.
So right now you're 8,000 a week allocation for all 3 counties?
Yes.
Okay. And then follow up on Tim's question. Right, when Phase 1B plus rolled out, it was supposed to be statewide. It was really by county basis. So is this different because allocation is just better? Or why are we sure that April 12th can be a statewide, besides Chicago, can be a statewide date? Because it wasn't previously.
So the biggest difference between the February 25th, when it was the option to move to 1B+, and now on April 12th, the full opening, is Johnson & Johnson is in play. During that time when the announcement was made for the February 25th, Johnson & Johnson was still going through the FDA approval. That just shows you how big of a game changer that vaccine is for us. And so with that, it kind of does change the playing field now.
So going back kind of to Andy's question here about vaccine shopping. So 16 and 17-year-olds, because Pfizer's the only one they're approved for, they're going to be forced into vaccine shopping a little bit here unless guidance changes in the next month. How how do you even recommend they go about trying to find the Pfizer specifically at this point?
So I would say start off with your healthcare provider. So we are still in the Tri-County pushing vaccine to our healthcare providers. And our healthcare providers, because of the way they're set up, are better equipped to handle any two-dose type of vaccinations, whether it's Moderna or Pfizer. So I really work with them as a kind of a starting point, and then really touch base at that the phone number that is statewide, because you might have Pfizer at some of our statewide sites. So it might be a drive, but then again, for 16 and 17-year-old, because that's the only option available, we'd recommend that you look for that.
Would there be any plans by the health department to straight up come into the schools and do this for 16, 17-year-olds?
So the question is, will we have, specific clinics for 16 and 17 based on Pfizer? And right now, it's really dependent on Pfizer allocation. And then likewise, because of how Pfizer is stored and your window of once you open the vial and how fast you have to use it, it does put a little bit more restrictions on it. And so again, if we're going to do something of that nature, a very targeted intervention, we want to make sure we're partnering with our healthcare systems on that.
Monica, one of the things I'd like to ask, are the three health departments looking at any other mass vaccination sites other than heading to those? Have we asked the state maybe to help in opening up such a site? Because you could, I guess, with the J&J, grab a whole lot of folks real fast.
So I think there's two parts to this. The first part is, will we be opening up a mass vaccination site as a tri-county in any area? As the governor mentioned today, they're hoping to have more guard sites available. They've reached out to every county to kind of look at assessments of what their community needs. So it's not outside the realm of impossible. But on the other side of this, as part of local health departments, we've always had what's known as public health preparedness programming. If you can think back to the H1N1 days where we had to plan for mass vaccination clinics. And so with that, part of getting the Johnson & Johnson is looking at those plans as well and seeing if some of those sites that we had, whether it's a school, an old shopping center, what have you, can be utilized and transformed rather quickly. So local health departments have already had those plans in place, and the Johnson & Johnson lets us expand into that. But like I mentioned, I know the state has been in contact with all of us just to see what sites or options are available and what makes sense in our community.
What are you guys doing to help people on transportation? You mentioned about the Pfizer shot for a team that they might have to drive a bit. There are a lot of folks, especially older people, who might not have a car, who might not have a place within walking where they can walk to. What exactly is your staff and the staff of the other departments doing to provide transportation for these folks?
So I can speak for Peoria City County Health Department. We actually early on partnered with AMT for that exact reason. We actually targeted supportive senior housing where transportation for the elderly population would be difficult, and then we brought the vaccine to them. Likewise, moving forward, we've already had discussions with our hospital systems and some of their home health programming to make sure that they can take vaccine out. And then lastly, when people are actually put their names on a wait list or give us a call and they mention that they have difficulty for transportation, we have actually sent out a cooler with a syringe in it and taken it to them at their home. So we make those options available as much as we can. And so we do want to make sure that we cover everyone and have that ability to get to the people that have transportation issues.
What is the percentage? Would you have any clue right now of where we stand of getting the tri-county population towards herd immunity? Obviously, that is a long way off, but are we making a substantial step towards it?
I think we are definitely making a substantial step. I think one of the key points is that even for Peoria County, we are now over 90% of our 65 and older populations vaccinated. And so I think that it's going to take time and we're going to move through that process, but I don't have the exact numbers right now.
Based on that, how far away is phase 1C?
So phase 1C, and this is I think kind of to what the governor and Dr. Ezike mentioned today, which is that based on allocations, it might be rather truncated, knowing that we have an April 12th time where it's open to everyone. We're now sitting here on March 18th. So in the next month, we do expect some of that 1C to start opening up. Whether or not it's dependent on local jurisdictions or it's going to be statewide, but then really gear us to that April 12th date.
So right now, it can either be by county or it could be a statewide order.
We're still waiting for that guidance.
Okay.
You mentioned 90% of the 65 and older population has been vaccinated. Do you have numbers on how many within the area of the 16 and older that qualify have been vaccinated?
I'm not sure about that, but those data points are actually available on the Illinois Department of Public Health website. If you go under vaccine data, it breaks it down by demographics, allocations, distribution, all that good detail.
Yeah, I guess really Peoria County is kind of leading the whole state in terms of the 65 plus. I mean, if you look at the analytics, I mean, if we're going on a county by county basis, Peoria County would be a space where we could move to that bridge today. I mean, so what do we need to do to get the rest of the state there? I mean, among your discussions there, public health administrators, who's falling behind, why, and how do we get them caught up?
I don't necessarily know if it's just falling behind. I think it's partly just allocation, and that's going to be the challenge. And so that's why the next few weeks are really important as more vaccine comes in that we're able to push it. And then, making sure that's readily available and then doing as much outreach as we can.
I'm not sure if you answered this before. We talked about allocation, 8,000 is current we have across the 3 counties. When we're at April 12th, what do you want to see per week? Did you use that figure already?
No, I actually don't know what I would want to see for a week, as much as possible. That would be the greatest. But I mean, we have a threshold with our own current capacity, but it's not just the local health departments. We have our Walgreens, our Hy-Vees, all of our pharmacies are also online. So I would like to see enough allocation. Well, right now, a lot of the distribution is still centered around local health departments having to distribute it to our FQHC and our hospital systems. I want to get to a point where there's enough vaccine that they can actually request it on their own and not go through us.
I know McLean has a capacity of 23,000, doses per week. What is your capacity? You could take on as much as you possibly could get.
Between the 2 hospital systems and the health department and some of our other partner entities, we're actually closer to about 30,000 doses a week.
And lastly, a lot of folks getting the vaccine. Johnson & Johnson, I've noticed, folks are getting the 1 dose, and they're sick within a few hours just because, it's a powerful dose of it. Any message for those folks, what they should expect? Should they prepare for a day off of work because it might be a pretty rough bout of it?
I think the key to recognize is that with any type of vaccine, your body is going to have an immune response, and we want it to have immune responses. It shows that your body's reacting properly. And so again, it's going to be uncomfortable. Some of our peers who've gotten their 2nd doses, or even the Johnson & Johnson, have mentioned that they feel like for 30 hours afterwards, it's been really difficult, and then they bounce up. So again, I think it's really key to recognize that that's part of the vaccination, and it's a normal activity, and so not to be concerned, and then just, again, take it easy, relax, Netflix and chill for a while, and then 30 hours later, you're back up and you are vaccinated.
Are you worried that, given how folks are now, that people are going to start to take this far less seriously? We are hearing numbers like some of the vaccines are 95%. We have, according to the data that you gave us, 97% of the folks have recovered. Some of those numbers said, hey, we are finished. I mean, it's all done. Are you kind of worried that this could come back with the variants and strains and just people being, normal?
So I think that is a concern that we have, and maybe to kind of close with that is the fact that we're seeing all this great movement, but not everyone has the vaccine. Not everyone is eligible to have the vaccine, and that's why we still need to wear masks. We still need to get tested if we're ill. We need to isolate and quarantine away from others, practice social distancing and hygiene practices, because this is a virus, and part of the biology of a virus is that it can mutate. That's why we're seeing the variants. So to have the vaccine to be as fast and effective as possible in the shortest amount of time, we have to give it a fighting chance. And to give it a fighting chance means until we get to a point where vaccine is readily available for everyone overnight, which we're not there yet, you're going to have to take those precautions, because every time the vaccine meets a new host, it has the opportunity to mutate. And so again, to slow this down and decrease the chances of mutations, we need to make sure we take on all of those practices. And so, yes, we are very concerned that people are getting a little bit complacent, can see the light at the end of the tunnel, the weather's getting better. I mean, everything's kind of building up to this, a positive energy. And I'm with everyone. I cannot wait for the day where it is just back to some normalcy. But I think there's something to remember. When we go to phase 5, the pandemic is now endemic, meaning that's now a natural part of our kind of viral history. And with that, it still means we have to be careful and cautious. And so, yes, I am concerned there is going to be complacency, and that's why, again, I'm going to reiterate the fact that not everyone's vaccinated, not fully vaccinated even, and so continue to wear your mask and socially distance.
When is this going to end? And what I mean, and what I guess I'm trying.
Are you talking about this press conferences or
No,
just?
but what I guess what I'm asking is, and again, I'm not trying to pick on you, but I think I'm speaking for every single person who's watching this, is that what you just said is this is now part of us. Much like the flu, much like the measles, much like the mumps. Are we ever going to be able to go back to where we could sit next to each other, where we could not wear a mask, where we can go back to how it was a year back? Well, a year and a few days. But the point I'm asking is, if this is now part of us, is this the new thing that we're going to have to wear these masks pretty much all the time?
Hopefully not. When it does move into a phase where it's just endemic, it means that we're able to coexist with that virus correctly. But again, I think more importantly, as a community, we've learned the fact that something that we don't see and something that's very unknown to us can really knock us down, right? And so again, really adhering to the science and the practices that come with it is going to be really important for not only to get through this pandemic, but sadly, we have to think about what else might come down the future.
We've been seeing a recent trend where local COVID deaths reported have been from case studies of people who died months ago. Why is that influx of past deaths now being reported as COVID-related deaths occurring more now than it had previously?
So the question is about the cleanup data for the deaths. Part of it is that we monitor a case for so many days after it's been found positive and then outside of its isolation period. After that, there is a window of opportunity, and I believe the coroner had spoken to it as well, where they do case review. So there is still a window of opportunity where the health department, while they should be notified, may not be notified. And so when we do these kind of routine checks, we do collect data during that back end.
Have we seen any of the variants locally yet?
Yes, we have, and that data is also available on the IDPH website. Well, thank you, everyone.